Good afternoon. The title of my research, the effects of different additional therapies in cerebral palsy. My name is Márk Pulay, and I am one of the conductors who is also participating in this great program. So I am the András Pető Faculty, which is the youngest faculty in the Semmelweis University. Our vision is that Pető method contributes to better quality of life of patients with cerebral palsy. And my mission is to find and implement new cutting-edge technologies and additional therapies which fit to the holistic approach of Pető method. To reach my mission, first I set up two projects. One of them is a meta-analysis, and the other one is a pilot study. The meta-analysis is I'm investigating the effects of additional whole body vibration in patients with cerebral palsy. But what is cerebral palsy? Cerebral palsy is caused by mostly paranasal noxa and characterized by abnormal tone, posture, and movement. And we can also classify about the muscle tone. And we can say that patients with cerebral palsy require lifelong therapies. We used to say conventional therapies such as physiotherapy, or in Hungary the well-known Pető method is also one of the conventional therapy in Hungary. And we're also looking for, and always looking for, some additional therapy which fit to our treatment. And one of this promising treatment is the whole body vibration. The vibration stimulates the tonic vibration reflex, and this reflex increases voluntary muscle contractions, and this is how, for example, it can help to decrease the spasticity of the patient. Our aim is to evaluate the effects of this additional therapy, mostly on outcomes on musculoskeletal system, patient with cerebral palsy. So I was waiting for this picture, so there was some mistake with the animation during the transformation, so I just go further. Here you can see this platform, the platform of the vibration, and there are different postures available during the therapy. I already described the patient population. The intervention group is those patients with cerebral palsy who get conventional therapy plus whole body vibration. Comparison is those who get only conventional therapy. And based on the literature review, there are really lots of outcomes, but we looking for those who has connection with the musculoskeletal system. The clinical implication of this research should be that this additional therapy should be considered for inclusion in conventional therapy programs. I conduct a systematic search in the most frequent databases, and I got almost 6,000 hits, and I'm already done with the title, abstract selection, with the full text selection, and I already start the data extraction. Our second project is a pilot study. It's already started a few weeks ago. The patient population is also a patient with cerebral palsy, but only children between age 8 and 12. This is a single-centered pilot study. I'm used to say this is a technical pilot study as well, because there are, of course, many technical questions. This pulsed electromagnetic field therapy has convincing experience in disorders with abnormal muscle tone, such as disorders as sclerosis multiplex or Duchenne muscular dystrophy. But however, there is no evidence of this therapeutic approach in this CP population. So this is why we aim to assess the beneficial effects of this additional therapy. So the clinical question is, does this additional therapy improve overall stability in abnormal muscle tone? I already said that our patient population now is children with cerebral palsy between 8 and 12. The conventional therapy, so the intervention group, is children who get conductive education plus pulsed electromagnetic field therapy. C is those who get conductive education plus placebo. I will describe later what placebo in this case mean. And our primary outcome is the overall stability, and the clinical implication is that this additional therapy should be considered for inclusion in conventional rehabilitation programs. So let me talk a little bit about the protocol drafting and also the study design. We set up eligibility criteria. There are so many exclusion criteria as well, such as patient with epilepsy or patient with dyskinetic disorders. So we designed, as I told, a single-centered, randomized, double-blind, placebo-controlled study. This is a picture about the device. This is a kind of pillow. And during the intervention, the patients get this pillow while sitting on their laps. And the placebo group will get the same pillow, but we don't turn the device on in that case. And this, during operation, this device has no voice, noise, or vibration, so there is no sensation that this device works or not. The flowchart of our study, we plan many measurements during the intervention time. Of course, we have a baseline measurement, and we use stabilometry, choice reaction time, hand grip to measure muscle strength. And we have the same measurement as the baseline and the end of the treatment, which will be 4 weeks, 16 minutes, 3 times a week in the intervention group. And to track the washout period, we will do measurements after the 4th, 8th, and 12th weeks of the treatment. So here you can see the penned submission date for both study, which investigating in 2 different kind of additional therapies among patients with cerebral palsy. My quote is that between stimulus and response there is a space. In that space is our power to choose our response. In our response lies our growth and our freedom.
Why did you choose this 16 minutes? I cannot understand. Why not 15, quarter an hour? Why not 20? What is this? What was the reason behind it?
This device, it's already available, and this device has specific programs. So it's already programmed for different kind of programs. And we choose one of the weakest during the weakest intensity of this therapy. So this is why it's 16 minutes, because there are different kind of programs, and this is one of the weakest. And this is a pilot study, so maybe we will decrease and we will change the program if we didn't find any effects after the intervention.
But what do you think about the usage of this magnetic
field therapy? Yeah,
in smaller children? Like, is it maybe more useful whilst they are learning these skills, or so? What do you think?
Yes, if it's increased, for example, the spasticity, it can be useful for all age population. The reason why we choose this elementary school age, let's say, because this is just a pilot study, and we manage it in the elementary school, and maybe when we start in our city, we would like to involve a wider range of age, of course, in this population.
Do you plan to follow up these children to assess the long-term effects of your intervention?
Yes, as I try to explain that we have different measurement or different after the treatment. So we would like to track the washout period, and if we find that after 12 weeks there is significant differences between the two groups, then yes, we will continue the measurements. So this is the plan.
Are you planning to compare these two methods, so the whole vibration that you are investigating in the meta-analysis and this electromagnetic field therapy?
Yes, it was planned. Thank you for your question. It was planned to make it crossover design and everything, so it was very complicated, and we decided that we start this pilot study, this technical pilot as well, because there are many questions, and the children in the institute has really strict time schedule, daily time schedule, and it's difficult to add both therapies in the same time. And yes, so let's see what is the results of this pilot, and then maybe we will investigate both additional therapy.
If the device doesn't resonate, doesn't make sound, or doesn't have a turn-on signal, how will you know if it's turned on or not?
Yes. It's a good question, thank you. We involved, because of the randomization as well, we involved assistant from out of the institute, from another faculty of Semmelweis University, and they are responsible for to manage this intervention or the random or the placebo intervention, and they have a device and they see they can program, they can choose the program, but the clients, the patients are not able to see, or it's hidden this panel from this control panel from the clients, so they cannot see what they are doing on the screen, on the touch screen of the controller.
I would like to ask if you would like to do differentiate between severity of cerebral palsy mixed groups.
Yes, we have, of course, the classification of the patients who involved to this study, but there wasn't any exclusion among the exclusion criteria of the severity of the patients. So we would like to see in any cases that this therapy has any effect. Exclusion criteria was the patients with dyskinetic disorders, which is also one of the most severe type of cerebral palsy. So in that case, I said no and yes, because also children with tetraparesis, for example, which is also several type of CP, they can be involved if they are able if we are able to make the assessment of with these children, if they are able to do the measurement of the stabilometry, or if they are able to press the hand grip of the muscle strength measurement.